Ekurhuleni Metro has donated over 1.4 million rand to the COVID-19 Solidarity Fund. It's from senior public officials who pledged parts of their salaries over the past 3 months. I'm now joined by the Metro's executive mayor, Zandile Masina. Mayor, good evening and thank you for your time. 1.4 million, is that the sum total of the donation, or are you expecting to record more donations?
Well, thank you very much, Thabo. We think that over the past 3 months, we've been able, working together with our coalition partners, in particular IRASA, as well as the Patriotic Alliance, joined by the Chief Whip, the Speaker, the City Manager, and the CFO, to actually make sure that we make this kind of donation to the National Solidarity Fund. We had pledged that over the next 3 months, we will put our salaries before, so that we can show our commitment as a nation to ensure that those that will be doing various procurements are able to assist us to ensure that the country is able to move forward. And I'm happy that I've been joined by these officials and politicians when we made this specific call so that all our people can be saved. And we want to take this opportunity to make a special call to each and every person that let's take good care of ourselves. Let's stop the house parties. Let's observe social distancing. And let's stay at home as much as possible when there's no need for us to be out there, because these are the things that are seeing the numbers surging. And I've just watched a clip from the Minister of Health and the MEC in Gauteng. It is quite worrying, and we can only make a call that let's work together. This was our contribution as the leadership of Ekurhuleni to the Solidarity Fund.
Now, Ekurhuleni being one of those hotspots, I think the third in terms of the number of infections in the province. Mayor, what leadership are you providing? I know a lot of power is resting with the ministers as far as making regulations and making rules of movement. But as the mayor who is close to the locality and the community, what leadership are you providing?
Well, there's a lot of work that we are doing. For instance, you would know that we recently closed the food bank, which was providing for the need, because during this time, many people could not afford to buy food for themselves. We've distributed way over 33,000 food parcels, covering almost 163,000 people. That's one of the initiatives that we're embarking upon. But also in terms of law enforcement, there's a lot that we're doing. But lastly, around just issues of health, I think that we're doing a lot of work around the testing and screening, working together with the province as part and parcel of our contribution, including looking at the areas where we have those shelters for the need. So, but now, I think when the president spoke, he emphasized the point that it is now in our hands, and we can only call on the communities to make sure that let's work together to support the initiative of government, because we can defeat this disease, but we just have to change behavior. And I really have made a call over and over that I think government must consider banning alcohol, because I think at the center of all these challenges or the surges that we're seeing is the abuse of alcohol by ourselves in different communities. That's a call that I want to make strongly to support our government if such a need arises.
Now, there have been, of course, some in the province who are calling for harder lockdown measures to be reintroduced again, seeing the surge in the numbers, especially in the Gauteng province. Would you support that call?
Well, look, Gauteng is different. We're an economic hub of the sub-Saharan region. It will be difficult to close down Gauteng. I think that we just need a sophisticated way in which we can work together, but also ensuring that we flatten the curve. To close the economy, I think that it will paralyze the country, and we've seen over the past few days when there was a total lockdown, and I think that many people lost jobs, many industries were affected, and we wouldn't want to go there. And all what we must say now, let's work together as government. Let's take the directive from the leadership of President Ramaphosa in ensuring that each and every one of us adhere to this regulation as pronounced by our government.
What we've seen is in highly densely populated residential areas in other countries, Mayor, people have been able to manage the spread of the disease. For example, is there an innovative way, as somebody who is in the East Rand, of how to handle the spread of the pandemic in Ivory Park or Mailula or Zonke Zizwe, which might not be similar to how you handle it when you live in Gauteng?
Well, the reality of the situation is that too many of our people live in abject poverty. So that's why we must continue fighting for equal society. And I know that this is another topic altogether, but the conditions that we find in the informal settlement in the main makes it almost impossible for our people to be squashed in one check. So that is why it's important that we must support initiatives such as the one that the minister is embarking upon, Minister Lindiwe Sisulu, who says basically we must decongest some of the informal settlement areas, because the conditions under which our people are living, they are quite deplorable. So it will be important, therefore, that we work towards ensuring that we normalize the situation. I don't think at this point we are in a position to compare what is happening in Gauteng vis-a-vis what is happening in Zongezizwe. These conditions are bad, so we must just put extra efforts as government in ensuring that we can really save lives amongst our communities.
You're making a call to the Solidarity Fund to investigate a feasibility of including supportive treatments. What are you referring to?
Well, there's quite a number of treatment that are being spoken about. There is a number of trials that are being undertaken, and I think that it will be prudent at this point to make sure that we are not left behind in South Africa. So I'm not in the position. I think the Minister of Health will be able to direct the country, except that we are just re-emphasizing the call that all those measures that are possible, because at this current moment, we are not using any sort of medication because we are told there is none. But if trials are being run, we don't want to be left out as a state of Ekurhuleni.
Could you be referring to the COVID medication that has been tried in Cuba?
Well, there's just many other trials that are being run. I know that the issue of Cuba excites everyone. I'm happy that the Cubans are here. They're doing their best to help us to manage the curve. And if there's a cure from, if there's a medicine, I mean, from Cuba, from elsewhere, it doesn't matter. All what we want to have a society that we are going to lead, because it can't be that we just fold our hands and say that there's a solution in China or in the US and we don't want to entertain it, including what is happening in Madagascar. All those things that must be investigated. Let's do so responsibly, and we've got our health professionals who guide us in terms of what needs to happen. And I must just, while you're on Cuba, say that when we made a statement previously, we were very clear that we will put necessary applications, which we did, by the way, and it was rejected by the Gauteng government because they say that they need to run certain trials and so on. We'll closely look into that, because so that if there is something that is we can find out of that, would still like to explore that and any other that will come elsewhere in the world.
But on a serious note, though, Mayor, you are calling for something to be included in the food parcels along the side of immune-boosting supplements or hydration solutions, or something that can help, particularly in pain relief and in dealing with basic fever.
Yes, while we are still waiting for vaccines trial and all those, it will be important that at least we get vitamins. We're told that there's certain vitamins that we need, vitamin C and so on. So it will be necessary, as government continues with this program of food distribution, that we add those vitamins so that our people can be safe, because we are quite worried. The numbers are alarming, and especially here in Gauteng. I think that it was quite correct for the government to make an observation that we are in hotspots, so therefore we need to be attended to. And this is basically based on the fact that we've got quite a large population numbers in Gauteng, and the provincial government is working very hard to ensure that the tests are being conducted here. Hence, we're able to see these numbers that are spoken to.
Yeah. Now, Mayor, you're making a call for people to really move and only when it's essential. But we are also talking of the situation of schools that are reopening, and some of the schools battling at this particular point with some reported cases of the virus. I mean, what is the solution there to the reopening of schools safely?
Well, government has to do a balancing act between ensuring that we don't lose an academic year on one hand, and on the other, we don't lose lives unnecessarily. And I've been following very closely some of the development elsewhere, that some of the schools are closing down in countries like the South Korea and so on. So it depends on the condition on the ground. I think that our government must be flexible enough. If we see a danger, we should be able to retreat at some point, but it is correct for government to ensure that we don't lose the academic year completely as things stand.
Talk to me about your hospitals. There's been some reports that some private hospitals there in Ekurhuleni are beginning to turn people away because they are running out of beds.
Well, not just in Ekurhuleni. I think the issue of beds is now a serious issue in the country. And that is why it's important that we must adhere to the call that we are making, that at least let's make sure that we don't over-congest hospitals. So the behavioral issue comes in here, because it will be important that we don't flood in numbers in hospitals, because that has got the potential of actually causing more problems for us as a country. So it's important, therefore, that we work together with government, and we strictly follow all the things that they are saying, because if beds are not sufficient as we know now, it therefore means that it will be difficult to treat each and every person who's being affected by this pandemic. I know that the MEC of Health is doing a satellite hospital now in Sinaba Stadium, as part and parcel of additional beds, as they've done in Nasrec and so on. So all these are efforts of government that are meant in ensuring that at least there's sufficient bed, but there can only be so much that government can do. That is why we're saying that let's deal with our behavioral issues in the main as residents, and I think that government has been doing its best, and it is now in our hands to contribute to the work of government.
And as a metro, are you reprioritizing some of your spend towards those extra beds and those field hospitals?
Well, we are working with the provincial government, because the mandate are different. So we will do everything within the mandate of local government, but we are not going to overstep the authorities of the provincial and national government with regard to the issues that are being raised.
May I appreciate your time. Thanks for indulging with us this evening and answering some of the other questions that you were not planned to actually speak to about today. I appreciate your time.
Thank you very much. Much appreciated.
Mayor Ekurhuleni there, Mayor Mzwandile Masina.